namely that antidepressants often do not do what they promise and are in fact causing harm to many.
Dr. Steve Hotze is suing over Obamacare's employer mandate.
It's time for a wellness revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctor.
Now, Dr. Stephen Hotze.
Thank you for joining us here today at Dr. Hotze's Wellness Revolution. I'm Stacey Banfield here with Dr. Stephen Hotze, who is the founder of the Hotze Health and Wellness Center. And just a reminder to go to our website, hotzepodcast.com. That's HOTZE podcast.com. You can download all of our podcasts. Very convenient. And this particular topic, this is something that concerns a lot of men, some women too, but mostly men. And it's about testosterone. It's one of those things that's so important to male health, but it's not really fully realized how important testosterone really is in men and all of the ways that it functions in their bodies. So Dr. Hotze, if you could just elaborate on that topic for us today, that would be great.
Well, let's talk today about testosterone and its role in heart health. Testosterone levels naturally decline as men age. So by the time a man hits 40 years old, his testosterone level is going to be about half of what it was when he was in his 20s. By the time he's 50, it's a third. By the time he's 60, it's a quarter of what he was. And as a result, they experience many negative health problems as testosterone declines. Did you know that left untreated, low testosterone levels can lead to serious health problems, including heart disease? And let me explain how testosterone helps prevent heart attacks. Testosterone protects the heart and the arteries and decreases the risk of heart disease. Testosterone lowers the blood pressure. It dilates the arteries, including the aorta and the coronary arteries of the heart. Testosterone also is low in individuals who have coronary artery disease or atherosclerosis. The studies have indicated that taking natural testosterone supplements can help reverse hardening of the arteries, known as atherosclerosis. Testosterone can also counter high cholesterol. It lowers cholesterol levels, and it helps relieve angina, which is heart pain caused by poor perfusion of the heart muscle by the arteries. So let's take a look at a few studies that show the benefit of testosterone on the heart. In one study, older men who were treated with intramuscular injections, they took shots, did not have an increased risk of myocardial infarction or heart attack. For men with a high risk of having a heart attack, testosterone use was protective against potential myocardial infarction or heart attacks. By the way, the medical term for a heart attack is a MI, or a myocardial infarction, which means poor blood flow and death to heart muscle. There was another study. A regulatory body representing European Union member states has agreed by consensus that there's no evidence that there's any increased risk of cardiac problems in men who receive testosterone products to treat low testosterone levels. Short-term administration of testosterone really creates a beneficial effect when you exercise individuals who have poor blood flow to the heart, and they get, angina. Well, when they give them a shot of testosterone prior to doing a stress EKG, it shows they have improved perfusion and their electrocardiogram oftentimes returns to normal. This effect may be very helpful in patients with angina, and it's directly related to testosterone's ability to dilate up the coronary arteries, causing they relax, and so it lowers the blood pressure and increases the blood flow to the heart. Administration of testosterone also increases the output of the heart, and this is because it reduces the load and the pressure on the heart that it has to pump against because it dilates up the arteries. You think about it, when you dilate up an artery, the pressure goes down. When you narrow your artery, the pressure goes up just like a hose. You got a big hose with a big diameter at the end of it. It doesn't shoot as far as if you have a very narrow hose that shoots out great distances because there's greater pressure. And so testosterone dilates up the arteries, lowers the blood pressure, enabling the heart to better have a better output of blood. Heart disease and cholesterol-lowering drugs have been implicated, but I believe that everyone, including conventional physicians, is fixated on lowering high cholesterol levels, but in truth, high cholesterol is not the underlying cause of heart disease. While most Americans are focused on a quick fix to lower cholesterol levels, the real killer is overlooked. The cause of heart disease is inflammation and damage that causes weakness in the blood vessels. Heart disease also remains the number one killer of men. No matter how many prescription drugs they take of Lipitor, Crestor, and all these other statin drugs, that's not the answer. First of all, cholesterol is not the underlying cause of heart disease. Secondly, these drugs have serious side effects such as memory loss, muscle damage, weakness, including muscle weakness in the heart because the statin drugs destroy the liver's ability to make coenzyme Q10, which is a very important cofactor in the production of energy within your mitochondria. These drugs also cause liver damage. I'm talking about the statin drugs, type 2 diabetes, kidney failure, and an increased risk of cancer. Remember, all drugs are toxins, and these statins are particularly toxic. So what can you do to protect your heart? Well, you can maintain optimal thyroid function since hypothyroidism increases the risk of inflammation and coronary artery disease. You can maintain optimal testosterone levels, which have a positive beneficial effect on circulation of blood through the coronary arteries because it dilates them and lets them allow more blood to flow into the cardiac muscle. The third thing you can do is eliminate toxins from your body by going on a detoxification eating program and taking vitamins and minerals that help you detoxify. Make sure you eat plenty of organic vegetables. I like broccoli, spinach, asparagus. Eat that routinely, almost on a daily basis. Also, supplement with vitamins and minerals. Now, the ones that are really key for the heart are vitamin C, and I'm going to talk about that in a future podcast, the importance of vitamin C. Magnesium. Vitamin C helps your heart heal the arteries. Magnesium regulates the heart rhythm and dilates the coronary arteries. Fish oil. Fish oil helps promote the ability of the blood not to clot. It keeps the blood thin. It's very important, but it's also even more important for brain function. Coenzyme Q10 is a molecule made by the body in lower amounts as we get older, which is poisoned in the liver. The enzymatic mechanism to make coenzyme Q10 is poisoned, but coenzyme Q10 is an important cofactor in the production of energy within the mitochondria. Vitamin D is very important. It strengthens the immune system. It enables your body to make cholesterol, which is an important molecule in your body because every cell in your body is surrounded by a cholesterol ring. And you have cholesterol in your brain, unique cholesterol in your body. It's the building block of your hormones. L-lysine and L-proline are important in the production of collagen, as is vitamin C, which help heal the arteries. And alpha-lipoic acid is very important antioxidant. When you have free radicals in your body, that's molecules that have an excess electron on them. The alpha-lipoic acid quenches that. It's these free radicals that can cause damage to tissue and inflammation. The next thing you can do is decrease prescription drug use. Why? Because prescription drugs are toxins. And you don't want to, you're already toxic because of all the petrochemicals in the environment and the metal you come in contact with, viruses and bacteria. High sugar intake and carbohydrate diets cause inflammatory products and make you toxic. So you don't want to add to your toxic load by putting pharmaceutical drugs in your body. Nobody is sick because they have low levels of pharmaceutical drugs in their body. Next thing you can do is exercise regularly. You don't have to run a marathon, for crying out loud. Get out and walk a mile or two every day. Then you've got to power down to power up. So get a good night's sleep. I happen to use a system called Brain Tap by Dr. Porter. You might look that up online. You can download that and put it on your phone, and you can plug in your earplugs. And he has music, and he'll talk to you on different topics. And I put him on, and I'm gone in 2 minutes. He puts me sound asleep. So how do we treat low testosterone naturally? And how would you know if you needed testosterone? Well, as men age, as I described earlier, the testosterone levels naturally decline. And there are several low testosterone symptoms that are very obvious to a physician who's trained in this to know that just on a clinical basis he's deficient. Remember, every man's testosterone level declines. So a man who's 40 has about half the level. A man who's 50, a third the level he did when he was in his 20s. And a 60-year-old, a quarter of the level. So if somebody comes in their 50s and 60s, I know they're going to be low in testosterone. And inevitably, this is what we see. We see lack of initiative, assertiveness, sense of well-being, self-confidence, moods go down, goal orientation, drive, directness, analytical ability. These are all brain functions. And the hormones affect your neurochemistry in your brain. Besides that, your muscle mass, muscle tone, cardiovascular function, and finally, your romantic moods and inclinations and abilities are all affected adversely when you have low testosterone levels. And testosterone also affects your stamina and endurance because you have to have good levels of testosterone to convert the inactive thyroid hormone to active thyroid hormone. By the way, some people with sleep apnea have as its underlying cause low testosterone levels. Testosterone, of course, is one of the androgen, that's male-type hormones that are produced by the testes. There are other hormones that are produced that are androgenic hormones like androstenedione and DHEA, and they're produced by the adrenal gland. But testosterone is the principal male hormone, and it's responsible for the development of external male sex characteristics, but it's also important for brain function. It helps young men mature, and really it makes them feel invincible. Which one of you had your 16-year-old boy go out and, I guarantee you, maybe you did this when you were 16, got in that car and got it as fast as you possibly could go to about 100 miles an hour. Remember doing that? Guess what that was causing that? That was the testosterone speaking to you. Well, testosterone is also the hormone of desire. It increases a man's romantic moods and inclinations. Now, men produce testosterone primarily from the testicles. They also produce some from the adrenal glands, while women produce small amounts of testosterone in their ovaries. Interestingly enough, they normally produce testosterone the day they ovulate because that's the day they're fertile. And God has a simple way of helping women want to be attracted to the men who they live with, who they're not attracted to other times of the month. That one day turns out to be a good day. Okay, what does traditional medicine do? Conventional medicine, how do they treat low testosterone? Have you gone to your physician recently only to have your blood work done, asking me if you have low testosterone? And he simply said, look, your testosterone level falls within the normal range. Why don't you just go exercise and eat better? Well, let me just stop and tell you something about that. The blood levels for testosterone go down every 10 years. So you have a range for 20 to 30-year-old, 30 to 40, 40 to 50, 50, 60, 60, 70. So who in the world wants to have his testosterone level when he's in his 60s and your doctors tell you, well, you're in the normal range? For what? For 60 to 70-year-olds. That means you don't have much. You want your testosterone level to be where it was when you felt in your prime. That's in your 20s. So lab ranges, as I mentioned, are age adjusted, and they're compared to other men in your age. You don't want to do that. So you want your testosterone levels, as I mentioned, to be where you were in your prime. If your cholesterol is high, your doctor will most likely give you a prescription for what? A statin cholesterol lowering drug. Now, how do I recommend treatment of testosterone? Well, we found that administering bioidentical testosterone for symptoms of low testosterone levels that I've described, regardless of the cause of low testosterone, is beneficial to the health of male patients. I like to say it puts a tiger back in your tank. Men, how many of you felt like your tiger's not in your tank any longer? Well, you want to put a tiger back in the tank. You want to get your initiative, your drive, your enthusiasm for life, your vim and vigor up. You want to be strong muscularly, and you want to have drive, both for your work, for your family, and also in your romantic moods and inclinations towards your bride. Like women, men experience a decline in their hormones during midlife, as I've described earlier. But the decline is gradual, so most men don't really appreciate it because from day to day you don't feel much difference because testosterone is produced every day by a man's testicles, whereas women fluctuate in their hormones during the month from estrogen to progesterone, and they create a balance. And then they have their period, and then they start all over. Men don't have that, so we don't feel the gradual and steady decline of testosterone until we finally get to the point you go like, man, I'm really not feeling good. I can't keep up with these younger guys. And your doctor just pats you and goes, you're just getting older. Learn to live with it. Well, the key is to replenish your testosterone levels and place them back in your body at the level that they were when you were young and vibrant in your 20s. So we use bioidentical testosterone. We also use another androgenic hormone made by the adrenal gland, which is DHEA, which also helps with muscle tone and muscle function and muscle mass. It also helps with brain function. So, do you have any of the symptoms caused by low testosterone? Are you in your 40s or 50s and 60s and feel like, you just don't have your get up and go anymore? Well, you can find out whether or not you're a candidate for testosterone without a blood test. Simply go to the symptom checker at our website. So why don't you tell them about that?
Sure. The website is www.hotzehwc.com. That's HOTZEHWC.com.
So thank you for joining us today, and I hope this gave you a new appreciation of the positive and beneficial and salutary effects that testosterone can have on your brain, on your heart, on your muscles, and on your entire life. It's such a critical hormone, men. I'll just tell you what, I started taking testosterone when I was 46, and I've been taking it for well over 20 years, and I feel like $1 million. Now, I may get run over by a truck tomorrow, but nobody's ever going to say Dr. Hotzey lingered.
Well, that's absolutely true. Dr. Hotzey, thank you so much for explaining the role of testosterone in men, how comprehensive it is. And again, you can always go to our symptom checker to find out if maybe you need some testosterone supplementation. So again, that's www.hotzehwc.com. That's hotzehwc.com. Or you can pick up the phone for a complimentary wellness consultation. We'd be more than happy to have that conversation with you. And that's 281-698-8698. That's 281-698-8698. Thank you for joining us today here at Dr. Hotzey's Wellness Revolution.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotzey's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.